Welcome to York University's Peer Health Educator Depression Training Module. This module will introduce you to some basic information on depression that you will need for the coming year in your work as a peer health educator, focusing on mental health. Please read these instructions carefully. They will guide you through the module. Feel free to work at your own pace, starting and stopping as you choose. However, please make sure you are done the module and all associated materials and team discussions by the date assigned by the Peer Health Education Coordinator. If at any time you have any questions about depression that are not covered in the module, please feel free to connect with your team lead or the Peer Health Education Coordinator. These learning objectives provide an outline of what knowledge you will be expected to gain by the completion of this module. Reading them carefully will help you recognize this information in the module and learn how to apply them in your work as a peer health educator. Depression is more than just feeling blue or sad. Almost everyone experiences a depressed mood now and then due to life's disappointments or difficulties. For most people, after a brief time of feeling sad, their mood improves. For many people, however, these sad feelings are much more intense and last much longer. These people may suffer from clinical depression. The following statistics were taken from the National College Health Assessment, a survey conducted in 2013 that aimed to highlight the health status of post-secondary students. These statistics are specific to York University. Before we begin talking about what depression is, we should start talking about who suffers from depression. Choose which answer you feel is correct and carry on with the module. Although depression occurs across all cultures, races, and ages, regardless of level of education, income status, or gender, certain groups do seem to be more vulnerable to the disorder. Young adults between 15 and 25 and people in their early 40s appear to be at a higher risk than people at other ages, and women are twice as likely as men to develop depression as well. Depression robs people of their energy, meaning many people with depression will have difficulty just getting out of bed, feeding or bathing themselves, or even cleaning their room. Especially problematic for students is the degree to which depression can impact the ability to concentrate. Unable to feel hopeful about the future or find pleasure in activities that they used to enjoy, those suffering from depression are at risk for harming or killing themselves. According to the 2013 National College Health Association, 58.8% of York University students report feeling that things were hopeless, with 7.5% intentionally harming themselves. According to the same data, 11.5% seriously considered suicide, and 1.8% of York University students had attempted suicide within the past 12 months. No one knows exactly why depression occurs. There is no one cause for depression. Rather, there are a number of factors that researchers now believe can contribute to development of depression. In some people, biological factors like a genetic predisposition may play a greater role, and in others, social factors may be more prominent in development of depression. About 15 to 20% of people with family histories of depression are likely to develop depression. Scientists who have studied mood disorders have also found a link between depression and imbalances in certain neurotransmitters, such as serotonin, norepinephrine, and dopamine. Chronic disturbances of normal daily rhythms associated with sleep disorders, shift work, or jet lag may also lead to depression. People who have had major losses in early childhood, such as the death of a parent or suffered extreme neglect, are much more vulnerable to developing depression as adults. People who are highly self-critical and chronic low self-esteem are also more likely to become depressed. People who are isolated and lonely and going through a major life disruption, such as divorce, the loss of a job and financial security, or the loss of a loved one, are at high risk for depression. According to the 2013 National College Health Association data, 62% of York University students reported feeling very lonely over the past 12 months. The physical symptoms of depression are often vague and may lead family doctors to investigate other possible health problems. Recognizing the symptoms of depression is the first step toward getting help and potentially getting better. Remember that a person who is depressed will usually exhibit both physical and psychological signs and symptoms. As you can see, there are a number of psychological symptoms that an individual may experience with depression. If that individual is able to clearly describe their psychological symptoms, a diagnosis of depression may be made more easily. Succeeding at university is challenging enough without having to deal with a depressive illness. Students can, however, succeed at university despite having to cope with depression. Departments such as Counseling and Disability Services in the Bennett Center and Glendon Hall have a number of services that can help a student succeed at university while coping with depression. It is important for the students to know that they can still succeed at university even though they're dealing with a mental health issue. And as peer health educators, you are responsible for giving the general student populations strategies to enhance their mental well being. These strategies include self care, time management, and fostering a sense of community on campus. Can you think of any others? Professional treatment may play a vital role in assisting students to understand their illness and how to manage it throughout their university studies. Professional therapists may help the student to better understand their illness, to accept that it may take longer to complete their studies, to keep their illness in perspective and believe that they can succeed, to focus on their accomplishments, to make use of available services and accommodations, and to develop strong planning, time management, and organizational skills. Professional therapists can help the student to get to the root of their issues and provide coping and life skills to help support their mental well being in the future. Students at York University are able to seek counseling services free of charge at both the Kiel and Glendon campuses. Contact information for these services are available on the resource slide at the end of the presentation. If a student discloses to you that they are depressed, you should not try to counsel them or try to get to the root of their issue. That is the role of a professional therapist. You should listen to them, be empathetic, and should encourage them to seek professional help if needed. You can share different healthy coping strategies for depression, such as exercise, self care, and let them know that they aren't the only ones feeling this way. Suicide is a lot more common than most people think. Suicide claims the lives of at least 3,600 persons annually in Canada. More than 80% of them communicate their intent to kill themselves before they attempt to do so. By recognizing the warning signs, we may be able to prevent the loss of some lives. Remember, according to the 2013 National College Health Association data, 1.8% of York University students have attempted suicide over the past 12 months. Although that number may seem small, in a school of over 55,000, it is quite substantial. While it can be hard to tell if someone is in crisis or distress, there are some indicators that can help you determine people's need for support. For instance, has someone that is usually very put together started looking disheveled? Has someone's drug or alcohol use changed? Class attendance? Participation in group discussions? Are they giving away their personal belongings? Have they started pulling away from friends and family? Has a person started talking about how everything is hopeless? How they wish they could just disappear? How they feel worthless? The loss of a loved one or a cherished relationship is just one example of a life situation that can cause someone to feel a great deal of distress. Other life situations that can cause a great deal of distress include trying to handle finances, academics, family situations, and more. Sometimes you may be even just to get a vibe that something is wrong with the person. They may seem not really there or apathetic. It is important to remember that the above indicators are not diagnostic criteria to determine if someone is in distress and/or crisis. They are things to watch out for and take notice. If someone discloses to you that they are in distress, you should ask them if they would feel comfortable going to Counseling Disability Services, CDS for short. If they do feel comfortable, please walk them over. Students experiencing crisis will be seen by a crisis counselor within 15 minutes or so. If you have any other questions about how to refer someone to CDS or bring them there, you can either call them during the summer months or bring your questions to August training, where there will be time to meet with a counselor during the topic time. Knowing what you do now about depression, suicide, and crisis, we hope that you have the necessary starter tools to empathize with someone who may be experiencing these feelings, validate their experiences, and connect them with resources that can better support them. Remember that although you may be a peer health educator, you are not a trained mental health professional, so it is not your place to try and diagnose someone or pick and choose which resources will be the best fit. Everyone has their own journey, and it is important that we validate everyone's experiences by having them tell us how we can support their journey. We can't judge anyone's feelings as good or bad. If someone discloses that they are thinking about harming themselves or others, never promise to keep it a secret. The likelihood is that they will need professional help over and above what you are able to provide. You do not want to put yourself in a position where you feel that you are betraying a confidant in seeking help. Call 911 security, as they can help to direct emergency services on campus, the RLC if you're in residence, and always follow up with the peer health education coordinator. Going through something like this can be traumatic, not only for the person in distress, but also for anyone supporting that person. Don't forget about self-care and debriefing to make sure that you are receiving the proper supports as well. There will be a Safe Talk training sessions throughout the year that can offer you additional training on how to identify a person at risk of suicide and how to properly get them the supportive resource. Your health education coordinator will send out dates as soon as they are available. These are a small selection of resources that you can share with students during your outreach activities. In addition, you should also know their hours of operation, location, and a summary of services they provide. Here are some links to websites with more information on depression and other mood disorders. If you would like some additional training, please talk with your team lead and the Peer Health Education Coordinator, and we will do our best to ensure that all of your training needs are met. We want you to feel prepared to be the greatest peer health educators that you can be.